In 1979, the world decided that we needed the Bayh-Dole Act because we needed to reform our patent system. And one of the modifications was we allowed recipients of federal funding to patent and retain economic interest in the research that the public paid for. You get a $5 million grant from the taxpayer, and then you get to charge the taxpayer a premium for the technology they paid to develop.
Pfizer's going to get nearly $2 billion. Moderna receiving $438 million in taxpayer money. And yet both companies have said they will not sell the vaccine at cost. They're going to make a profit on it. Should pharmaceutical companies profit off this vaccine research that taxpayers have helped fund?
The Bayh-Dole Act failed the American people because rather than standing on the shoulders of giants, we now kneel at the feet of greed. My systems flagged anomalies when I started seeing nonprofits and corporates and cover financing for coronavirus programs in the late summer and fall of 2019. Our first red flag came out when we read the World at Risk scenario. Now, there is an organization called the Global Monitoring Preparedness Board. This organization is a part of the World Health Organization, and this board includes Dr. Elias from the Gates Foundation and Anthony Fauci from NIAID. These two individuals, plus the director of the Center for Disease Control in China, come out with a recommendation that says that by September 2020, 2 global pandemic preparedness exercises have to be completed. And one of them has to be done on the release of a respiratory pathogen that then gave rise to an October event, Event 201.
On behalf of our partners in the Bill and Melinda Gates Foundation.
Event 201 took place 5 months before COVID-19 was declared a pandemic. The participants of the event are some of the same people that are now deeply involved in the real pandemic and profiting from it as well. Event 201 was a scripted, multi-camera, live event that was broadcast globally via the internet. An event of this complexity and magnitude would take months to write, prep, and produce, placing the conception date at least 1 year prior to the actual pandemic.
There is no question that there will be a surprise outbreak.
Anthony Fauci knew as early as January of 2017 that we would see an outbreak before the end of 2020. Even Bill Gates, a man with no medical training, knew it was coming.
If we start now, we can be ready for the next epidemic.
Every single thing that you have seen play out in front of your eyes, all of them laid out in their tabletop exercise, which, by the way, fact checkers have said has nothing to do with the coronavirus outbreak. Just happenstance. This is that wonderful universe of improbabilities where events just co-emerge and then nature conveniently backs itself into our architecture. That's the scenario we're supposed to accept. Brilliant.
Some countries have banned travel from the worst affected areas.
The president has made a decision to suspend all travel to the United Kingdom and Ireland.
Dis and misinformation circulating over the internet.
Across the world, misinformation about the virus is being shared online.
A significant demand for N95 masks and gloves are on the rise.
The demand for N95 masks to prevent the deadly airborne virus has surged.
We could eventually have 52 million treatment courses per year, but it will take many months to get there.
We're still many months out from having something that we can really deploy to the public.
And 65% of those polled are eager to take the vaccine, even if it's experimental.
A new poll finds that 49% of Americans say they would get a COVID-19 vaccine should an effective one be discovered.
I'm curious, who wrote the Event 201 script? If the visionaries of the event knew at least 1 year in advance what was needed, why didn't they take care of those things? Considering that Bill Gates has donated half of his fortune to make the world safer, why didn't he help to better prepare our hospitals and frontline workers? Why didn't any of the event's wealthy sponsors do something?
Now here we are. We didn't simulate this, we didn't practice.
On behalf of our partners in the Bill and Melinda Gates Foundation.
So both the health policies and economic policies, we find ourselves in uncharted territory.
Event 201 was not the first scripted exercise to prophesize the future with astonishing accuracy. Leaders of global health and business have been seeding reality with fictional scenarios for several decades.
The scenario obviously is fictional.
1 year prior to Event 201, many of the same sponsors, hosts, and actors came together to produce a tabletop pandemic simulation for a fictional virus they branded Clade X.
1 year to produce a vaccine for this is too long.
We should have stockpiled, we didn't, but we're going to have to look at that vaccine question to see if we can speed up the delivery.
And if we do not have the public with us, we're in big trouble.
In 2010, the Rockefeller Foundation released a 54-page document called Scenarios for the Future of Technology and International Development. Page 18 features the pandemic scenario, Lockstep, a world of tighter top-down government control and authoritarian leadership, with limited innovation and growing citizen pushback. China's government was not the only one that took extreme measures to protect its citizens from risk and exposure. During the pandemic, national leaders around the world flexed their authority and imposed airtight rules and restrictions, from the mandatory wearing of face masks to body temperature checks at the entries to communal spaces like train stations and supermarkets. Even after the pandemic faded, this more authoritarian control and oversight of citizens and their activities stuck and even intensified.